This is for arterial blood gases, so you have a physician that's ordered arterial blood gases on a patient. You're going to check their chart, check for that order, make sure that order is in place, and then see if they have any medications they're taking that may thin their blood, or if they have any bleeding disorders. That just means you would hold pressure longer after the needle stick. So you would gather your supplies and head to the patient's room. Hello, Mr. Blank. My name is Trisha. I'm with Respiratory Care, and the doctor would like me to get some arterial blood gases today. This is just blood obtained through the arteries instead of the veins, so it's going to go a little bit lower in the arm than what you're used to with the blood draws. And it's a needle stick just like the other one, but we're going to use it lower in the arm. So I'm going to go ahead and wash my hands, and then I would apply my gloves. And Mr. Blank, we're going to do a little test here. I'm going to first make sure you have enough circulation coming through that arm. So I'm just going to have you relax your arm here. I'm going to put pressure on two of your arteries. So I'm going to put pressure on your radial artery and your ulnar artery. Go ahead and make a fist with your hand for me. Then I'll have you open the palm of your hand, make another fist, and open again. See how your hand is blanched there. There's not much color in your hand. So if I release that ulnar artery, your hand is pinking right up. You're getting that return very quickly. So that means there's enough circulation in this arm we could perform the test. So I'm just going to rest your arm just underneath a towel. Have you bend it down just a little bit. Again, relaxing it, but bend it down a little bit. This is just going to help stabilize that artery. And I feel that artery palpating very well right above your thumb there. So I will cleanse the area. And can I get your name and date of birth? You got to verify that you're the correct patient. Okay, so I'm going to rub in a circular motion for approximately 30 seconds. And then I'm going to clean up my fingertips. And here is the needle we'll use. We're going to pull back at least 5 cc's, a little bit more to get enough for analysis. And then we're going to palpate that artery. And then I'm going to go in at a 45-degree angle, bevel up, until we see that blood flow return. It will fill the syringe by itself, and it will be a little bit lighter than venous blood. As that's filling, as we get to that mark where we want it, we're going to hold pressure as we remove that needle. Then we're going to place the needle into the cork here. I'm going to hold this pressure for 5 minutes. If they are on a blood thinner of any sort, or they do have any bleeding disorders, we will hold pressure for at least 10 minutes on there. Then we're going to check the site for any swelling or hematoma. If there is swelling or hematoma, we would apply a little bit of ice. But it looks good, so we're going to apply that Band-Aid. Then we're going to fill out our information on the syringe, patient name, date of birth, their ID number, the time the sample was taken, and their oxygen status. If they're on a ventilator, we want that to include that information as well. Then we would put the syringe into a filter device and remove the bubbles. And then we would put this into our biohazard bag and get that to lab for analysis as quickly as possible.